Hello, everybody. Welcome to my presentation on operation notes. My name is Berkay. I'm a third year medical student in the University of Sheffield. I'm currently undertaking my student selected module at the Delta Health Center, supervised by Mr. Sami Abdul. So today that we're going to be pretty much having a look at why the operation notes matter, why you should know the UK standard when it comes to the operation notes, how to write those notes quickly, uh, and to how to avoid common mistakes of omission. So, just a quick question. After a laparoscopic appendectomy, what would the ward nurse need from your notes before accepting the patient? So, they would need your operation notes. Why the operation notes matter? Because they ensure that the continuity of the care is present, and in terms of what have happened in the operation, we can think about it in a medical legal term, that you are covering your back and you are also protecting your patient as well. Also, the safety aspect. It records any sort of complications, implements specimens, or any sort of like post-op risks that you may have seen, and it also ensures that the quality of the services that, in terms of surgeries that you're doing, can be audited, can be coded or researched upon as well. So it's pretty much the core principle is you write it so that another clinician can safely continue care without needing to guess. The NHS standard when it comes to operation notes just is the NHS England CPOC. CPOC. So it's the operation sheet that we can see over here, where you have the consultant name, where you have the anesthetist name, where you have the surgery, the anesthesias, sort of like what has been given, the preoperative diagnosis, and the operation title. And you start by doing the uh, exercises, what sort of procedures you've seen. So this is just like an example note that you can see there. Um, so your job in the theater is to fill in the operation note fully. Uh, it needs to be legible and it needs to be able to be usable immediately after the procedure. What the Royal College of Surgeons require is who, patient ID, date, time, elective, non-elective, surgeon assistant, and anesthetist that was in the surgery. Why? The procedure title, pre, post op diagnosis, indication, incisions, and approach. What happens, the findings, extra procedures, tissue specimens, the problems and complications, and how it ends. The closure technique, estimated blood loss, antibiotics, antibiotic prophylaxis, any sort of VTE, or and you have your detailed post-op plan as well as your signature and your title. One simple test. Could the night team safely manage the patient using only your note as well? So imagine that your operation note has a very detailed post-op plan. So if you can think about that, I think that's a good way of understanding how important operation notes are. So operation notes, you can think about them in six sections. I love sectioning things to be able to memorize them. The first is your admin. Just think about the patient, the time, the team over here. The secondly, you think about the reason of why the operation has happened. Thirdly, the findings of what you have seen in surgery in terms of any sort of relevant negatives or estimated blood loss, etc. And what sort of procedure you have done. So you're thinking about the positions such as like Trellenberg position or any sort of like prone or supine position, your incision and your closure techniques, etc. Uh, Five, you're thinking about what plan that they're going to do after the surgery. So the overnight plan that we were discussing about. So the analgesia they might be needing, the VTE, the antibiotics, the drain that might put in, the follow-up procedures that they might need, the amount of changes in their dressing that they might need, etc. Also, the sign-off in terms of your name, your grade, your signature, and your contact details there as well. So section 1 and 2, as you can see, the name, date of birth, timing, and anesthetic. So the operation title would be such as laparoscopic appendectomy, not lap appy. We don't ever we want the operation notes to be legible, so we don't want any shortcuts. Also, state the indication. So write it fully: suspected acute appendicitis with localized peritonism, and list the combined procedures. So we have loads of operations. Let's say in the surgery, we start with the major ones and we move on to the minor ones as in terms of the relevance for the operation notes in terms of post-op recovery. Also, section 3 and 4, we're thinking about the findings and procedures, as we talked about. So we want to be a bit more specific about our findings. We want to make sure that we have the size, the site of the site, the appearance, severity, and any sort of relevant findings that we can see. And we're thinking about the procedure as well. So we want to make sure that we have enough detail on what the operation was like to be able to um, have a good understanding of what the post-op sort of care or any sort of audit may need. And we want to be honest in our procedure details as well, because we want to make sure that we're covering the medical legal background as well. So no complications would mean pretty much just if if you say no complications in your operation notes, that would only be at the end of your note when you have completed everything. Just so imagine you have went through the 6 steps on completing your operation note, and now you're thinking about, oh, you know what? I didn't actually find anything in terms of my procedures or my findings. Now I can say no complications now. So 5, post-operative plan. So we're thinking about the immediate plan. So we're thinking about any sort of analgesia or antiemetic that they might for any sort of symptomatic relief. And we want to think about the observation and the nursing side of things, as well as any sort of escalations if anything else happen. And we want to start thinking about any sort of treatment and management as well. So we're thinking about any antibiotics in terms of any sort of risk of infection, any VPE prophylaxis to prevent any sort of DVT, or any sort of fluids and diet changes and regular medications that we would be starting back on as well. Also, we're thinking about, especially after any sort of abdominal surgery, we're thinking about any sort of drainage. In case of what actually comes out of the drain, we want to measure it, and observations come in handy there. Catheters, if we have needed to put one, dressings and packs that needs changing, and also, after the treatment and the postoperative plan starting, we want to think about the next steps as well for the upcoming shifts. Imagine that we want to continue with their treatment in such a way that we want to make sure that the continuity is provided. So we want to think about their bloods, we want to think about their imaging, we want to think about their physio and discharge plan as well for our future colleague that will be taking over. Um, so please just don't write routine post-op care as that is not detailed enough, and we would need more details at what you would actually want for this patient that matters in their post-op treatment. So we want to also prevent any sort of omissions that, and we want to make sure that we are checking the operation notes. So time, not only the hour and the minute, we want to ensure that we have dates and we have how it was started, etc. We want to make sure that we have all the patient identifiers in there, and we want to make sure that we have the estimated blood loss properly written down, any complications, implants. We want to ensure that they are written down properly, especially in implants. We want to make sure that their device and their serial number is written down so they can cross-check if they, let's say, if they are going to go for MRI, they want to cross-check their device, just saying if it's MRI safe or not. They can check their serial number from their operation notes, from their sort of medical history. Um, Antibiotics, we want to make sure if it's given or not given and what has been planned, etc. And in terms of VTE, we want to assess and give prophylaxis where it matters. In terms of their post-op plan, we just don't want to have any vague phrases. We want to make sure we are giving a specific treatment plan. And also, we want to make sure that we are not missing our signature. Um, okay, so just a quick interaction. I would like you guys to be able to remember 3 sections in your mind and just write any sort of omissions that could be useful. And you can stop the video and write these down, and we can continue. Yep, starting back up again. So we're gonna have a quick look at this exercise. So we are planning to write our operation notes after or laparoscopical appendectomy. So this is what has one of our colleagues have written. So what is missing from this? If you can take a quick pause and have a look at what it might be. I will continue now. So we are looking for the patient identifier. There isn't any. There wasn't any date or time. There wasn't any team or anesthetic members names there. There wasn't any indication of diagnosis. There was just the surgical um, it is too short as well, especially saying that it's laparoscopical. You don't want to be vague here. We want to make sure that like we have the indication. We want to make sure that we have the incisions and the ports. We want to make sure we have detailed findings of what was seen. We want to make sure that like the estimated blood loss was recorded. Specimen destination upon collecting the specimen from the appendectomy. Also, we want to make sure that like we have the understanding of the closure and dressing and what was given there. We want to make sure also we're thinking about the treatment where the antibiotic is not given here or said anything about routine post-op care would not detail. It's too vague, unfortunately. So thinking about any sort of the specific post-op plan, and Dr. S could be anybody starting their name with S in the hospital. So we want to make sure that like, we're not vague and we have our full signature and grade to be able to ensure we have accountability and backtracking when it comes to our operation notes. Back to the notes. So concise but not complete. So this is you can have a look at this and pause the video. And to continue, we have also a World Health Organization patient safety checklist before any surgeries. And this sort of actually does give you an understanding of what is actually written in the first section, 1, 2, 3 of the operation notes as well. I feel like this is a good point on firstly, the safety aspect of the operation itself, and secondly, what is actually written in operation notes. And I feel like it's a good sort of descriptor. So, take home checklist. I want to make sure before you leave the theater that you have written your operation notes properly. And as you can see on the right hand side, is the patient time and team, what was planned and why, what was found, what was done, complications, estimated blood loss, specimen implants, antibiotics, VTE, and devices, clear, post-op plan, and name, grade, and signature. So, 3 questions as you can see on the left side, and you can answer them in your own time. Thank you very much for listening to my presentation. These are my references. Thank you.